Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
Special investigation by ITV News has uncovered a new crisis in the NHS. Thousands of jobs that nobody seems to want. A freedom of information request answered by almost 100 NHS trusts in England, Scotland and Northern Ireland has revealed shocking numbers of posts for both nurses and doctors lying empty. More than 1,700 in one health trust alone. It amounts to a potentially damaging shortage of people willing to work in our hospitals.
Alison Ledson has worked for the NHS for over 2 decades.
I've got a patient to hand over to you.
She loves her job as an A&E matron, but without enough staff to go round, she's forced to rely on the goodwill of her nurses.
Our patients are getting good care, but that's based on the staff doing extra, going above and beyond, and staying late to make sure that things are done properly.
Is it sustainable?
It's not sustainable. I'm seeing higher levels of sickness rates, and generally speaking, staff that you know are tired of coming in and working with one less staff member on shift than they should have.
Somehow, the staff here have managed to lift the trust out of special measures, despite being 401 nurses short. And they're not the only ones. We asked every trust in the UK how many staff vacancies they currently have. 92 trusts responded. In Northern Ireland, the Belfast Trust, which manages 8 of the city's hospitals, has 1,236 unfilled vacancies. While Bart's Hospital in London, the biggest hospital in the country, has 1,732 vacancies. But it's not only nursing positions that are going unfilled. North Cumbria has 48 vacant consultant roles, while Calderdale and Huddersfield has 44 consultant roles going unfilled. Many chief executives tell me that finding the right number of people with the right mix of skills is now the toughest part of their job. And while some gaps can be filled with agency staff, all of this has an effect on patients. There simply aren't always enough staff to run services safely.
Trusts may well need to shut wards, and we do see that up and down the country. We also know that they may need to cancel operations, and what it means as well is that they need to employ expensive agency staff in order to cover those gaps and run a safe service.
The Health Secretary points out there are now 15,000 more nurses than 6 years ago.
The truth is you can't magic up doctors and nurses. They need to be trained. We've increased the number of doctors we're training by a quarter. We've made big reforms to nurse training, and it will take time before these new doctors and nurses come into the system. But this is absolute priority for us because we want the NHS to offer the safest and best care in the world. While we're getting there, though, we recognise that it is very, very hard work for doctors and nurses in hospitals because there's a lot of pressure.
And that pressure is relentless. A&E attendances are up by almost 6% since 2010, a jump that hasn't been matched by NHS funding. No wonder staff feel as underpaid as they're overstretched, with no choice but to shoulder the burden.
I mean, Rachel, those numbers are staggering. How did we get to this kind of situation?
Well, it's certainly not for want of trying on behalf of the hospitals. A number of the trusts, particularly in more remote areas of the country, told us that they had re-advertised for these posts, some of them very critical posts, up to 4 times, but still to no avail. And in a number of instances, these vacancies had been there for over 2 years. I think there's 2 problems here. The first is one of recruitment. 6 years ago, the government cut the number of nurse training posts by 10%. We're still trying to recover from that. But whether or not the government's learnt the lesson is questionable, because the decision this year to scrap nurse training bursaries has already seen the number of applicants for those courses falling. There is another factor, Brexit. It's not the biggest factor, but again, we've seen the number of EU nationals wanting to work in the NHS dropping off dramatically. Then you've got to hang on to the staff you've already got, and a big issue here is pay. Over the past 7 years, we've seen consistent real-term drops in the amount that people are getting paid. That has a devastating impact on morale, just as demand is going up. And I think it leaves staff in the impossible position now of trying to cover gaps that are not of their own making, whilst bearing ultimate responsibility for patients' welfare. Despite that, they still tell me they love their jobs, but you've got to wonder how long the NHS can rely on their goodwill.
You've got to wonder indeed. Rachel, thank you very much indeed.